Thank you for staying with us. Now, optimal health has never been more important. Dr. Oluseun Ogunnubi is back with us to continue our discussion from last week on optimizing your mental health awareness during this pandemic. Hello, Doctor. Good morning.
Thank you so much for having me. Good morning.
How are you doing?
Well, I'm fine. You can see I'm on the road moving.
Exactly. That's one.
So we woke up together.
Okay. What time did you wake up this morning?
Thank you. Well, I had to wake up as early as 6 o'clock because of certain runs. You know, Lagos runs.
Okay. For me, 6 o'clock.
Because of that, I had to go. I had to sleep earlier. As I said, we need to maintain good rest.
So, you know,
So
Doctor,
I
for me.
Earlier and I woke up.
Okay. For me, Doctor, 6 o'clock is actually very late. If I wake up by 6, I remember when we had our first discussion, you spoke about the importance of sleep when it comes to mental health.
Sleep. Yes.
Yeah?
Yes. So you have to make sure that you sleep early if you know that you have to wake up early. I know people in Lagos will say, how is that possible?
In fact,
actually possible.
Let's pick up with that. How in Lagos, as Lagos is, where some people would have to stay in traffic up until maybe 10 before they get back home. At times you're even too tired to sleep. It does happen. How do you pick up? How do you get enough sleep in a city like Lagos?
So they should ensure that their weekend is sleep. I tell people, Monday to Friday, no problem. But all those accumulated sleep areas, make sure weekend is not the time. Thank God for no one bed now. Thank God that you can stay at home. Make sure that Saturday, Sunday, you now use it it's like you are repaying your body back for what you have lost. But finally, you see people, even on Saturday, they still go and do some runs. So Sunday, you have to do something. The truth is that if you break down all those things you think you need to put in place, we still wait. So why try to say, I have to be there, and you neglect the alarm system, you neglect the resistance in your body until the body goes to a state of exhaustion. So if you can't do Monday to Friday, I always plan on that weekend, make sure you don't joke.
All right. So, Doctor, let's kick off from where we stopped last week, talking about optimizing the mental health awareness during a pandemic as such. Of course, we've mentioned sleep. What are the other pointers that you're about to give us now?
Yeah, so we mentioned sleep. We talked about the need for rest. We talked about cutting our coat according to our size. This is not the time to choose what your neighbor is choosing. This is not the time to do things beyond your level. We talked about the need for you to acquire new skills. You need to, because jobs are downsizing, many people are losing their jobs. And for you to be relevant in this present age, you need to understand new technology, new ways of doing things. This is not the time to live in analog age because we're in digital. We're even moving past the digital. We're in sheer speed, ultrasonic speed. So you have to keep up moving. And to change, of course, this is the constant thing. It's also important for people to know that they need to understand their system. What are the type of coping strategies you are using? Do you know some people use maladaptive coping strategies? They either drink to stupor, they either get aggressive, they either displace and run away from home, run away from their responsibilities, all because the pressure is so much on them. This will further boomerang and it will be a vicious cycle. This is the time to apply adaptive coping style, look at others, learn new things, ask questions, resolve issues, look at other ways you can do things, look at how to cut your coat according to your clothes. These are the adaptive ways, not being, aggressive, not being reckless because the situation has overwhelmed you. It is also important for people to know that it is okay not to be okay. When you are overwhelmed, seek for help. When people ask you, how are you doing? It is good to tell them, I am not fine. Don't monitor. Don't say I am okay when you are not okay. So this morning, people should learn that it is okay not to be okay. It is not a sign of weakness. It's actually a sign of strength. When you know you have emotion, your emotion is feeling down, you have no mental fitness, and you need to seek therapy. Don't say, God forbid, it's not my posture. I will pray about it. I will go and seek. No. That is the time. Also, we tell people that it is good for us to be empathic this period of time. If you have 10, give to those who don't have at all. Watch your neighbors. You must empathize with them. You must connect before you condemn.
Wonderful.
Those are the things I've been talking in the last 3-4 months. Connect before you condemn. Look at the reason why your children are behaving this way, because they are at home. They are not in school. They are tired. They are asking, where are my friends? So some of them will go into regressive behavior. They start bedwetting. Some will be throwing tantrums. Some will just be disobedient. Why? Because they're overwhelmed. They don't know. You are even going out as parents. Children are locked down at home. So most of the times we need to empathize. We need to understand that they are going through a lot so that you don't become very angry when they do certain things, and that will also boomerang and we will continue to have. And this is the time to have family reunion. If you have parents, this is the time to call them. We say it is physical distance, not social distance. We are social animals and we cannot afford to socially distance from ourselves. It is important that we connect, we have family meetings, we have everything can happen virtually, but we still know that we are connected. Ask after your friends, know how they are doing. It is also possible when you begin to feel certain symptoms, like you want to feel withdrawn, you are tired, living every day is so mechanical. Help is near. Call for help. Don't say, I will man it up. You are not sleeping. You are restless. You are panicking because you are paying salaries for people who are not even working because you have asked them to work from home. You have to pay house salary, especially owners of schools, proprietors, and co. So this is not the time to be anxious. This is the time to seek for help. How do I do it? Going to therapy, going to psychiatrist does not mean you are mad and you are really mad walking on the road. It means that you are going to the mental health therapist, psychiatrist, psychic, brain. It does not mean you are mad, you are wearing dirty clothes and you are picking things from the gutter. It all means that you are not sleeping well. It all means that you are almost sad most of the time. It means that you are always getting panicky. It all means that you are getting anxious. It means that your mind is not at rest. You cannot do things you used to do. You cannot concentrate the way you used to concentrate before. Your memory is failing you. These are the kind of people that you seek help. It is okay not to be okay. And that's what I'm rounding this session up this morning, that it is possible for people to be weak. The same way you have malaria, typhoid, arthritis, you can also have any problem with the brain, because the brain is an organ, just like the heart, the lungs, the kidneys are organs in the body. And they can fail. They can fail in their function. It doesn't mean that heart, liver, all those ones are medical. But when it comes to brain, it is arrow of the enemy. It is mother-in-law in the village. It is people you did not send money home. They are the ones that are not saying they will deal with you. No! We should stop all this myth and know that any of our organs can fail. Mental health, physical health are so important. So as we maintain physical fitness, we must always maintain emotional fitness.
Thank you so much, Doctor. You struck a chord with that one. It was a home run. Thank you so much. Looking forward to rounding this up with you next week. Have a wonderful day, Doctor.
Thank you so much. Thank you.
All right. Oh, now that was quite an earful, and of course I hope you were able to educate yourself and get enlightened with that one. Okay, so there's mental health, there's physical health, there's also what do you call it now, stomach health or what?